Ministry of Health and Sanitation on Saturday, 24 July at the Emergency Operations Center in Freetown received relief medical equipment from the Africa Union Centers for Disease Control and Prevention. According to the Africa Union CDC representative, Dr. Justin Meada, the donation is to ensure that the medical supplies needed by Sierra Leone are readily available following the request made in response to the ongoing transmission of COVID-19 pandemic response. Presenting the medical equipment to the Health Ministry, the Africa Union CDC representative pointed out that the aim of the Africa Union is to take up challenges in health emergency. He said a few days ago, Dr. Austin Derby had a meeting with the Director General of CDC, during which he requested support. He said the Minister and the Director General of CDC also discussed about the progress made in responding to COVID-19, especially the third wave.
Current and the upcoming challenges in a timely and effective fashion. That dream of the head of state is now coming to reality. A few days ago, the Minister of Health of Sierra Leone, His Excellency Dr. Austin Derby, had a meeting with the Director General of Africa CDC in a discussion on the progress made in responding to COVID-19 Sierra Leone and in looking at the new challenges, especially on the third wave. And they also mapped out the areas of collaboration whereby the government of Sierra Leone can make with the Africa CDC. Within that meeting, and a few days now, we see all these supplies and also the team of Africa CDC being in country. It's a full demonstration of this dream and wisdom that our head of state and government envisioned a few years ago. We don't see this as a donation, but rather the collaboration, the coordination that has been.
The chairman for NACOVAC, Dr. Sheku Bangura, thanked the Africa Union CDC for their support. He called on the Africa Union to start thinking.
List of vaccines. Sierra Leonean Health Institution, the Pharmaceutical Board, has said it will approve, it will ensure that it certifies those that have been approved by WHO. They are good for you, take them, and we will advocate. Everybody must be vaccinated.
Commending the Africa Union through the Africa Centers for Disease Control, the Minister of Health and Sanitation, Dr. Austin Derby, extended his gratitude to the Africa Union and stated with pride the progress the country has made in dealing with a global problem, which is more so an invitation to continue preventive mechanisms. He resounded the need for more vaccines, but most importantly, a more vaccinated population. He encourages Sierra Leoneans to continue to respond to the 4 health regulations, which are wearing of face mask, hand washing, avoiding crowded places, and taking vaccines. The items were presented to the Ministry of Health and Sanitation and then handed over to the COVID-19 implementing body NACOVAC through the National Chairman.
We had a second wave, an increase in the number of cases. Again, as a nation, with the tools available to us, we came around. We fought it, we flattened the curve, we bent the curve, we dropped it as a nation. So we're a resilient nation. We argue amongst ourselves, we fight a little bit, but when it comes to issues like this, we always come together and we fight effectively. So now we have a third wave. Unfortunately, the third wave is a lot meaner than the first 2 waves. We have newer, much more virulent types of the virus that replicates much, much quicker, that transmits much, much quicker. And you know, what we've seen around the world is the third wave causes real devastation to people. The number of cases increases fairly rapidly.